Let me guess, you are struggling to prepare for the SLP Praxis exam because it is a flippin' hard test. Video, I'm going to show you how to use a game-based approach to remember tips and tricks you will never forget. I'm Sam, and I'm an SLP, and I'm about to change the game of your SLP Praxis studying. I know how hard it can be to prepare for the Praxis. You're in graduate school probably, or you're in your clinical fellowship. You're like, how the heck am I going to remember all of this information? Which I get it, and I've definitely been there. With the right tools, it does not have to be that hard. In this video, I'll show you a snippet of what it's like to be in the SLP Test Prep subscription. The SLP Test Prep is a game-based subscription model that really helps you prepare for the SLP Praxis or things like your comprehensive exam by really testing what you know and what you don't know. And if you're competitive like me, when you throw things into a game, you all of a sudden learn things better. Before we get started, I want to make sure you have all the tools to kind of help this be the best experience possible. You're going to want to have like a pen and paper available, or maybe your notes app open on your phone. I'm going to present a question, and because this is just a video, you're going to have to write your answer down. So I'm going to present a question. You'll have like about 30 seconds to a minute to answer it. You write your answer choice down, and then I will explain why that answer was correct and why the other choices were incorrect. It's a very short snippet of what the SLP test prep is like, but I just wanted to give you an example on what this is like. So if you wanted to join later on, I will give the information at the end of this video. So without further ado, let's test that brain. The SLP test prep is not affiliated with anything. I am my own person who just does this because I love helping people. So I'm not affiliated with ETS, the Praxis, ASHA, none of that. It's just me. But I am Sam. I'm a New York-based SLP who has a huge passion for helping graduate students actually survive grad school. There's one thing to like get through grad school, but there's another thing to like survive and thrive through it. And looking back on me as a grad student, I was absolutely not thriving. So I try to help people thrive through grad school now because it kind of is possible. So that's a little bit about me, but you guys aren't here for me. You're here for some fun questions. So the SLP test prep, what is it? So most grad students, like I said before, when I said Praxis on a scale of 1 to 10, most of you were somewhere from like the 7 to 10 mark because it's a scary test. You go through graduate school and you're like, holy crap, this test is testing everything that I'm supposed to know. So I tried to come up with a fun way, and I put fun in quotation marks because studying is probably never fun. But I tried to come up with like a fun, engaging way to help you really understand what you know versus what you don't know. Because when I was studying in graduate school, I would always try to memorize the textbook. I would look at something and I'd say, okay, let me ask myself a question. I would ask a question or do the questions like at the end of the chapter. I would get it wrong, and I would totally convince myself that had it been the real day of the test, I would have gotten that question right. When in reality, I probably wouldn't have. I probably would have gotten it just as wrong as I did right then and there. So I came up with the SLP test prep, which is a way to really test your knowledge on the spot. You have a question presented to you, you have a minute to answer. Do you know it or do you not know it? I personally like when SLP test prep members get them wrong, because then they will take it, hopefully, and study that topic more, because studying things you know is a great pat on the back, but it's not necessarily what you need. You need to start studying the things that you don't know, or the stuff that you're not able to actively recall all the time. So that is what the SLP test prep is. You guys will get a good visual of what it would be like to be in it today during our game show, but that's a little bit about what it is. Some benefits that come with being in the subscription are the Discord chat. We have a Discord chat. This is a screenshot of it. There's more stuff on the bottom. But this chat kind of really helps you to connect with clinical fellows, other grad students who are taking the Praxis, who are taking comprehensive exams, who just really are in the same boat as you. You guys can complain together. You can share study material. There's a lot of documents that go around in this chat about people sharing study material. It's basically just a place for you to have like-minded people around you to help you pass these things. So this is a good plus because there's subcategories. We celebrate when you pass. We answer things when you're confused. We talk about graphics, quick things to memorize. So let's say the night before the Praxis, you're like, I don't want to study, what should I do? You can go into quick facts to memorize, see if you know all of that. So that is our Discord chat, which you get access to when you subscribe. There are also interactive worksheets on the Patreon. So this is an example of what one of our interactive worksheets look like. And the reason I call it interactive is because there's different pages to it. So the first page will have all of the information. So for example, for this dysarthria one, it will have all the information. And then the interactive part was that I've deleted something. So I deleted all the location of lesions for these dysarthrias. I've kept you with the primary deficit and the name, and you tell me the location of lesion. It's back to that active recall. Are you able to look at this and say, okay, I know this location of lesion for flaccid dysarthria, but I don't for spastic. So I'm going to star this because I know later on I have to study this. So these interactive worksheets really help avoid that memorization piece. You're not just memorizing words off of that large book. You're actually seeing like, okay, I understand this and I know this and I'm able to answer a question when asked. So these are the interactive worksheets that are available once you subscribe. And that's my blabber about the SLP test prep. All right, let's do this. The most common prevention for Ranke's edema is beautiful. A lot of you got it right. Let me explain why ceasing smoking is the #1 answer. So the most common way to prevent Ranke's edema is to have the patient stop smoking. Cigarette smoke is a common cause of Ranke's edema. Edema happens when there's too much fluid in the vocal fold. And then when this happens, the space between the vocal fold and the mucous membrane fills up with thick, sticky fluid. So Ranke's edema is not something we probably talk about a lot in class, but if this question came up, you'd probably like, oh my gosh, I have no idea what they're talking about. So let's break it down. So Ranke's space is a part of the vocal folds. The vocal fold has many layers and Ranke's space is part of it. Edema is swelling caused by excess fluid trapped in your body's tissue. So if you see here, there's excess fluid, that thick, sticky, mucousy fluid in here. So just break it apart. Edema, we know, is that excess fluid trapped in the body. Ranke's space is part of the vocal folds. So when we think about it like that, okay, there's swelling and mucus in the vocal folds. What would really irritate that? Inhaling smoke. So we would want the patient to stop smoking because that is an irritant to Ranke's edema. Swelling plus smoke does not go well together. So just knowing the foundation of these words like edema would kind of really help you answer this question if you had no idea what Ranke's is or Ranke's space was. So if you didn't get this question right, I suggest you write edema down as a vocabulary word for yourself later to study. This procedure involves the insertion of a feeding tube into the stomach through a hole placed in the abdomen. Beautiful. So a gastrostomy was the correct answer. So this is just a screenshot of the question. I kind of want to show you how to answer these questions on the Praxis. I'm going to break the news to you right now. You will not know every single answer to every single question on the Praxis. Most likely. There's people who do,
Most people will not, because it is so much information in your brain that you have to know on a timely basis. So if this is a question you looked at and you're like, holy crap, I have no idea what any of these choices mean, break it down. Esophagus, that E word, right? We know esophagus. Esophagus is the pipe that goes into your stomach. Here they're talking about a feeding tube that is already in the stomach. So we're not talking about that. A pharyngostomy, the pharynx. We know the pharynx is up here, nowhere near the stomach. So there's no way that they could put a feeding tube in the stomach with something that has to do with the pharynx. A nasogastric feeding tube, we talk a lot in speech pathology, so I'm sure you knew that. But if you didn't, naso, nose, that's all the way up here. There's no way that it's a surgery that has to do with the stomach. So gastrostomy, if you think about it, when you have problems with your stomach, you're lactose intolerant, you go see your gastro doctor. That is stomach. You just have to relate these words to understand what the choices are to really help you just answer the question correctly. Because like I said before, these standardized tests are not meant to test how well of an SLP you're going to be or how much you know. It's really a test to test how well you can take these tests, how well you can understand what the question is asking, and just really putting the correct choice. So back to that question, a gastrostomy tube, also known as a G tube, is a tube that's inserted through the belly that goes directly to the stomach. It is one way that doctors can make sure that people who have trouble eating get the fluid and the calories that they need. A surgeon puts a G tube in during a short procedure called a gastrostomy. Which observation would not be visible on a lateral view of a video fluoroscopic swallow study? So the correct answer was asymmetric residue in the vallecula. And let me tell you why. So we're talking about which observation would not be visible on a lateral view of a video fluoroscopic swallow study. So this is a lateral view. This is the view we usually see. It's the side of the face. So you're looking at the profile of a patient. This one right here is an anterior view. So if you're looking at the patient straight on. So a lateral view of a video fluoroscopic swallow study, the clinician cannot see the asymmetries and residue between the two vallecula. This means that it would not be possible to determine which of the two vallecula contains residue or how much. The clinician needs to use an anterior view. So really quickly, here you see there's residue in the vallecula. Here we see that there's only residue in the patient's right side because it's backwards. So I don't know if you see this like dark area right here. That is residue. But on the lateral view, we only just see residue in the vallecula. On the anterior view, we see that it's more mainly on the patient's right side than it is on the left. That tells us more information than just this. So the other choices were aspiration. You most definitely will see aspiration on a lateral view. This is most of the time what we're looking at. Lingual pumping is when the tongue kind of does this sort of movement. You will definitely see that because here is the tongue. And then nasal regurgitation, I know in this picture you can't see it, but typically you can see if liquid would go up towards the nose. So asymmetry in the vallecula is something that you would not see on a lateral view, but you will see on an anterior view. During an oral mechanism examination, you notice your patient sticks out their tongue and it deviates to one side. Which cranial nerve is most likely injured? Beautiful. Does anyone want to take a shot at what cranial nerve that is?
Facial.
Not the facial. Facial 7.
Trigeminal. Trigeminal.
Hypoglossal. Does anyone get super confused by Roman numerals? Yes. Okay. I'm about to give you a trick. I'll give it to you right after I explain this because I don't want you to lose it. So there are 3 ways that the hypoglossal nerve can be damaged: at the hypoglossal nucleus, above the hypoglossal nucleus, or interrupted at the motor axons. You're not going to have to know that. That's way too specific. I'm just trying to give you all the information. So when this happens, it causes paralysis, fasciculations, which are small muscle movements, kind of like a twitch of some sort, and then eventual atrophy of the tongue muscles. So they're just not working anymore. If one of the 2 nerves is damaged, then the tongue will deviate towards the damaged nerve because of the overreaction of the strong genioglossus muscle. Now, let me give it to you visually. Say this claw clip is my tongue. You have this muscle on the left side and this hypoglossal on the right side. And when they both work, they both push out your tongue equally, right? Let's say the right one doesn't work. Your right hypoglossal goes bye-bye. So you're holding, your left hypoglossal nerve is really trying to hold it up for the team. When you stick your tongue out, your left hypoglossal nerve is working really hard because it's trying to make up for your right hypoglossal nerve that's not working anymore. So it's going to push it out and push it to the side. Do you understand that? Does that help a little? That good visual? So when you push it out, it's going to push to the side that is damaged because nothing is pushing this side out. So it's going to push towards the damaged side. That is a hypoglossal. Let me go to my Roman numerals lesson. I left these little notes here so I can remind myself to give you guys these lessons. I do this a lot in SLP test prep. I like to blabber, but hopefully it helps. So for the sake of cranial nerves, for speech pathology, you need to know V and you need to know X. V is 5, X is 10. The way I remember it is that you only need 1 hand to make a V. So V is 5 because you only need 1 hand to make 5. X, you need 2 hands to make X, so X is 10. So X, you need 2 hands, it's 10. V, you only need 1 hand, it's 5. If the I's come before the V or the X, it's subtraction. So IIX would be what?
3.
8, exactly. And then if the I's come after the X, it would be addition. So VII would be what?
Also
7.
7, which is the what nerve?
Facial.
Okay, this question is going to be confusing, so I've given you more time. You're going to match the etiology of cleft palate with the correct etiology subtype. So this may be really small, so take a look up at your screen if it's too small on your phone. At the top, number 1, you were going to put these in order. So at the top, you're going to put the one that's a genetic abnormality. Then second, you're going to put the environmental factor. Then the third, you're going to put the mechanical factor. And then fourth, you're going to put the one that's not an etiology. So you're going to order it from 1, 2, 3, and 4. When you order it, be sure to press submit after or it's not going to enter. So again, 1 is genetic abnormality. The second one would be in the environmental factor. The third one would be the mechanical factor. And then the fourth one would be the one that is not an etiology. And we're talking about cleft palates here. Okay, so this was a hard question. I will not lie to you. This is a hard question, but the etiologies of all these syndromes and genetic things are hard to remember. So I try to ask questions about them so you get used to answering questions about them. The correct order was that the first one, the genetic abnormality is Treacher-Collins syndrome. That is a genetic syndrome that can cause cleft palate. The second one was the environmental factor. If a baby was has fetal alcohol syndrome, that could be an external environmental factor that can cause cleft lip and cleft palate. The mechanical factor is twinning. Twinning can cause cleft palate. And then premature birth is not an etiology of cleft palate. Babies with cleft palate can be born premature, but being born premature is not going to cause cleft palate. So because this is so confusing, I've created one of these interactive worksheets for it. So this is an interactive worksheet. This is an example of what the first page would look like with all the information. The following pages take out the top, the following pages take out the bottom. Then after that, it gives you these 3 boxes blank with a word bank. So you get to put them in order. Super interactive way to kind of help you understand all of these things. Twinning is when there's a mom is like pregnant with twins. Mechanical factors are things that are physically wrong or issues in the uterus. So intrauterine crowding, if there's not enough room for the baby. Twinning, uterine tumor, if there's a tumor in the uterus. Amniotic ruptures, those are things that physically are happening that are wrong. Does that make sense? Yeah, it's super simple. I think that's what you're saying. It was that, yeah. I try to explain things as simple as possible so that it really just sticks the same question. There genetic abnormalities, there's something wrong with the genes. Environmental factor means something is happening outside of the mom's body that will cause things on the inside. So if the mom is drinking alcohol, if there's drug use, if the mom is taking prescriptions that there's side effects to, if the mom has an infection of rubella, things like that. Mechanical is inside, environmental is outside, genetics is genes. Which muscles depress or lower the rib cage? Beautiful. Internal intercostals. Someone asked, how often do they change the questions for the praxis? This is a question that I get asked a lot. The honest answer is I have absolutely no idea. That is up to ETS. I don't know when they change it. I don't know what topics will be on the praxis that you take, the next one. I have no idea any of that information. And I always tell my subscribers, do not rely on that. I know there's things that you read on the internet about topics, but you cannot rely on that because you have no idea when they're going to change it. So if you say, okay, that these topics are going to be on the praxis, I'm only going to study these topics. Then you go to take the praxis and that happens to be the first day that they change the test, you're going to be screwed and you're just going to screw yourself. So just try to study everything. What I highly suggest is study things that are hard for you because that will be your downfall when you take the praxis. That's my little spiel about the topics. But yeah, so this is internal intercostals. Now, I try to come up with tricks for everything because associating funny things and anything to these topics help you remember it. So there's the internal intercostals and the external intercostals. The internal intercostals depress the rib cage, and the external intercostals help the rib cage go up and out. When you're breathing in, you need that space. So when you're depressed, what do you want to do? You want to stay inside. So when you need the ribs to go depressed down, you do use the internal intercostals, because when you're depressed, you want to stay inside. When you're excited, like the external intercostals, you want to go up and out and go shake your booty on some club floor. So that's how I remember that. Depression, inside. Excited, you want to go up and out. Does everyone understand that? Okay, I'm gonna assume, okay, cool. Because the reason I'm saying this, and I want you to understand this, is because once you understand the foundation of this information, you can answer any type of question that is going to be thrown at you. So internal intercostals, you're depressed, you want to say inside. External intercostals, you want it to go up and out because you're excited. Now watch this. The blank pulls the rib cage downward to decrease the diameter of the thoracic cavity. Beautiful. So that was, the answer is the exact same from the question before to this question. It's just that the question is worded differently. So the more, am I frozen? Okay, I was frozen for a second, sorry. Can you all hear me okay? Okay, I was frozen for a quick second. So it's the same answer that you're getting, but just a question that's worded completely different, which is why I really tell people don't get tripped up on the way they ask you. Just try to understand what they are asking you. Once you know that foundation of the information, depressed, in, excited, up and out, you're able to answer the question once you understand it. Exactly like that. I hope that kind of helped you a little and boosted your confidence because you guys know this information. It's just the tricky ways that they try to ask you. This is the same thing we were talking about before. Internal intercostals, depressed, because you want to stay inside. They're right here in the yellow. And then the external intercostals here in green, up and out. Let's get over the external. True or false? The middle ear has 4 bones. Oh my gosh, you guys are flying through this question. Yep. So the middle ear does not have 4 bones. It has 3, exactly. 3 bones. And they are the malleus, the incus, and the stapes, and they all make up the ossicles. So another way to remember this, another acronym to throw at you is miso. If there's any sushi lovers in here that love miso soup, like myself, this is a good way to remember it. But be careful to not let it trip you up because miso is a 4-letter word. Do not let it convince you that there's 4 bones in the middle ear. There are only 3, but it's that they're called the ossicles. So those 3 bones are together are called the ossicles. So it'd be M for malleus, I for incus, and S for stapes equal the ossicles. I'm going to explain a little bit about the SLP test prep. So we are currently only have 1 type of subscription. Come September, we will have a once a month, a 1 class a month subscription, which will be a lower price. But we currently only have our unlimited subscription. With that I'm still saying lower. With that unlimited subscription, you get access to 30 previously recorded games. Just like this one, there's 30 other ones. In that is over 900 test prep questions. And then you'll have an explanation after every question like you did today. So if you get a question wrong and you don't understand why, there is an explanation after. Like I gave you some today, there are tips and tricks to remember the material, acronyms, dirty jokes, funny things. Like some of the worksheets, you have over 30 study resources, such as those interactive worksheets, which are PDFs, videos that I post, and graphics that I find or create myself. Then you also have the private community, which is the group messages on Discord. You get access to that as soon as you subscribe. And not only do you have access to the Discord chat from the day you subscribe, but you'll be able to see everything from the day I started that Discord. So it's really a great resource. And just another benefit, you'll get a monthly Speaking of Semantics coupon. So that is the current unlimited subscription.